Good morning, Chad.
Good morning.
Good morning, TQ.
Good morning, peeps. How you guys doing?
Good.
Good.
Good. You ready, Chad?
I think so.
I know you are.
I'm getting to the point where I can talk food banking in my sleep after being here this long.
Well, that's good.
Uh-huh.
That's real good.
So TQ, I think I'm not on camera, but I'm the host. So I'm trying to not have my little box with my name on it up here. But it may just be what it is. So I apologize if
Yeah,
it's
that's fine. Yeah. It's not a distraction for me whatsoever.
Actually, if you click the three
Oh, I
dots in
found
the
it.
top right corner.
Yep, got it. I went away. I figured it out. I am still here if anyone needs anything.
It looks like you can pin too. So if you wanted to pin the presenters, that might be something worth looking at.
I just have, it's a webinar, so it'll just be the panelists. It'll be you, Lori, TQ, and Elise.
I gotcha. Perfect.
Yeah, I use Teams a lot more than we use Zoom, but Zoom has been great for the webinars.
You're lucky, Marissa. You get to work behind the scenes today.
I do get to work behind the scenes. I know, you know me, I can have my giant cup of coffee without anyone seeing it.
Yeah.
Chad, those second harvest shirts are great. I just saw one that Sarah had of like a turkey trot, which was very cute.
Actually, I've got my chief operating officer. He's kind of got a look. He's a little scruffy. He's Navy Reserve, so he cleans up when, he's retired now, but when he would get called up, he'd have to shave and all that. But he retired, so he wears a lot of those turkey shirts and then a Bass Pro Shop cap backwards and has a real scruffy beard. And so we had an all-staff meeting yesterday, and everyone dressed up like him. So Sarah and Elise would really appreciate knowing that. We'll have to get them some pictures.
Oh, that's a very nice honor. Good morning, Elise.
Hey, Elise.
Hey.
I was just telling Marissa, everybody dressed up like TJ yesterday.
Oh gosh.
They had the turkey shirts and the backwards Bass Pro hat and
Oh no.
fake beards.
Oh, that's terrible. So
Good morning,
everyone's
Lori.
then.
Good morning. I am, we actually just had our fire alarm go off in our building. So I am in my car parked across the street, but also just waiting for it was not a fire drill day. So we don't know what's going on.
Oh, okay.
Oh
Right.
my goodness.
As long as everybody is safe, right?
Yeah.
I believe everybody's going to wait for updates. But I'm going to, maybe when I'm not speaking, I'll just go off camera. And I'll mute myself. I hear the alarm, but I just don't want to make people, I'm holding this in my hand. I don't have a place to put it up in my car. We'll figure it out. So apologies.
It always happens that way.
Things happen, right? Chad's like, yeah.
Yeah. You've got something you have to be quiet for, that you've got to be focused for, and something happens. Yeah. It's just the way.
So anyway, sorry about that.
No, I hope everything's okay.
We had fire extinguisher training for everybody yesterday. And I was like, this is what I do every day. I put out fires all the time.
All right, I do see folks joining us. We have 2 folks signed on so far, so let's give everybody a few more minutes. Lori, did you have the wave of beautiful like summer weather the last couple days in Philly?
We actually just today we're getting the sun out. It was a little bit foggy and rainy. Last night the sun came out. So yesterday afternoon the sun came out. So it's starting to be pretty fall weather.
Oh, it was like 74 for the last 2 days in Vermont, and it's like summer before we get, winter.
No, we haven't seen that yet. Send that to us, please.
Couple more panelists, or sorry, a couple more attendees signing on.
Marissa, I just wait for your cue to tell me to go. And then once Marissa tells me to go, we'll just run right into it. And then just go from there. Okay.
Sounds great. Okay, a couple more folks have signed on, including Caitlin, Ashanti from Baylor Scott and White. Great to see your name, Ashanti. Kathleen Martin. So we have about 10 participants so far. Florence Ryan from Baylor Scott and White. Great to see your name, Ryan. Okay, TQ, we're at the top of the hour, so you're free to get started.
Awesome. Thank you so much, Marissa. And good morning to everyone. And thank you for joining our second webinar, Addressing Hunger as a Social Determinant of Health. So as you guys know, we had our first webinar, which took place last month, and we discussed the process of getting food to the community. We had Jensen McLane, who's the chairman of McLane Global Logistics, and of course, Marissa Parisi, the director of McLane Hunger and Health Solutions. But today we are talking about social determinants of health and food insecurity and its impact on the overall health of individuals. So today we are focusing on food banks and how they address hunger as a social determinant of health. And we have 3 awesome panelists with a robust background, and I'm so excited to start this conversation with them. So let me just take a moment just to say welcome to our panelists. Today we have Chad Higdon. He is the CEO of Second Harvest Community Food Bank. So good morning, Chad.
Good morning.
We also have Ms. Elise Miller, who is the manager for McLane Hunger Solutions. Good morning, Elise.
Good morning.
And lastly, we have Lori Jones. She is the CEO of Phil Abundance. So good morning. Lori, I know you're having a little unpredictable morning, but we appreciate you striving through to be here this morning. So good morning to you, Ms. Lori. All right, so in a moment, I'm going to ask our panelists to introduce themselves and tell us a little bit about their organization and their mission in the community that they serve. But before we dive into this conversation, I just wanted to talk a little bit about social determinants of health and food insecurity and the role food banks play. So among the various social determinants of health, food insecurity has one of the most massive impacts on the overall health of individuals. The USDA found that food insecurity affects 11% of U.S. households. Additionally, individuals who are food insecure are disproportionately affected by chronic disease, including diabetes, high blood pressure, and obesity, which can intensify adverse effects on overall health and well-being. Food insecurity in households is caused not only by poverty, you guys, but also by other overlapping issues such as affordable housing, social isolation, location, and chronic health issues. Households with limited income often face unwelcome trade-offs between food and other types of necessities. However, food insecurity is not solely a problem among impoverished, unhealthy, and socially isolated families. Many families reporting food insecurities have incomes above the official poverty line. The charitable food system is vital for access for vulnerable populations in nearly every community in the United States. So food banks play a major role in the food aid sector by distributing donated and purchased groceries directly to food insecure families. The public health implications of food insecurity are significant, in particular as food insecurity has a higher prevalence among certain population groups. Food banks have the potential to improve food security outcomes when operational resources are adequate, provisions of perishable food groups are available, and client needs are identified and addressed. So studies demonstrate significant roles food banks play in improving food security. And of course, recently, we all know for the first time in more than half a century, President Biden hosted the White House Conference on Hunger, Nutrition, and Health to push the action for millions of Americans struggling with food insecurity, diet-related diseases like diabetes, obesity, and hypertension. So the Congress laid out a vision for ending hunger and reducing diet-related diseases by 2030. We got a lot of work to do by 2030, you guys, all while closing disparities among the communities that are impacted the most. The conference just shed the light on some of the great work that our current panelists are doing right now. So I'm going to take a pause, and I just want to congratulate and just say thank you to you guys and all of the great work that you guys are doing, because as I just demonstrated, that is such a great impact on the community. So I just want to take a moment just to ask all of our panelists to tell us a little bit about your organization, your mission, and the population that you currently serve. Chad, I'm going to start with you.
Sure. I'm Chad Higdon. I'm the CEO of Second Harvest Community Food Bank. We're located in St. Joseph, Missouri is where our facility is. And then we serve 15 Northwest Missouri counties and 4 Northeast Kansas counties. So our largest population hubs are Leavenworth, Kansas, and then the city of St. Joseph, Missouri. So 80,000 is about our largest city. And then we have a lot of very rural, hard to reach areas. I think our smallest county has around 2,000 total population.
Awesome. Thank you. All right, Ms. Lori.
First of all, good morning, everybody. Thank you so much to McLane for this opportunity to talk with my counterpart, Chad, but also to all of you. McLane's such an important partner to those of us across the Feeding America Network, supporting food banks. We're really grateful to you for that. As TK referenced, we just had a fire alarm go off in our warehouse. And so I'm a little bit in transit, but I appreciate, as Chad knows, we food bankers just roll with it. And so for allowing me to participate in this important conversation. Fill Abundance is a food bank, the hunger relief organization that serves southeastern New Jersey. And so we serve suburban areas, rural areas across this particular region. We started as a rescue organization, food bank. We knew that if you took half of the food that was thrown out in this country, you could feed everybody who's hungry. But we really have evolved. I think of us more as a social services organization. In addition to ensuring that people have access to fresh, healthy food every day, increasingly more people, and it's increasingly harder to do that in this environment. We also are really committed to addressing those root causes of hunger. We're very aware, as this panel suggests, of the connections between poor health outcomes and poor nutrition security. And so we have, through workforce development program and through a new good food policy I'll talk about a little later, really said we want to make sure that we're not just feeding people, but ensuring that people are healthier. So that really is our commitment here. In terms of size and scope, we serve 9 counties. We used to serve about 90,000 people a week. We serve upwards of 135, 140,000 a week. In our region, over 500,000 people are food insecure, according to the USDA. And in terms of pounds, and Chad knows, we often talk about pounds. I'm not sure if you could give a sense of the scope. We used to distribute about 25 million pounds of food. We're now distributing 55 million pounds of food a year. So reaching lots of people, providing lots of food, but increasingly trying to make sure that that food is healthier for people and more, and also more culturally diverse.
Awesome. Thank you so much. And we're going to, like Ms. Lori talked about, we're going to dive a little bit more into the specific work and the specific populations that you guys actually serve, because I know, Chad, your population looks a little different than Lori's population. And so, Ms. Elise, I know you work in a different sector. You worked in food banks previously now. And so now you work for McLane Hunger Solutions, where you actually provide the produce for a lot of these food banks. So could you just tell me a little bit about the work that you do, the organization, and some of the different areas that you're able to assist?
Sure. So it has been an interesting change. I was at Second Harvest Community Food Bank with Chad for about 6 years, and then from there came to McLane Hunger Solutions. So it's been interesting seeing this side of it, but it's great because I can help so many food banks. We help food banks across the country. And I mean, really, we help with whatever they need as far as their food needs, as far as we even do non-food. If there's anything that they're looking for, we can typically find it. We have warehouses in Houston and in Riverside, California also. So, I mean, really, we can just find about anything. And it's great being able to help so many different food banks with anything that they need.
Yeah, and I think, and like you said, Elise, I think it's really interesting because you were actually in the food banks and you understand the logistics and the operations of what CEOs have to deal with when it comes to actually finding those types of food. So you have that inside scoop and have a lot more empathy when it comes to understanding what each organization is going through. So just one more question for you, Elise. What areas do you target? Are you in a specific region of the US or?
So my region is the Northeast region, and I've also now taken on the Northwest region. So I kind of have both sides of the United States.
Awesome. You got a large region to take care of. But we thank God for that. All right. So another question you got. So the studies demonstrate the significant role food banks play in improving food security, health outcomes. Can you all provide us with an example or a story of how your organization has impacted food security and health outcomes in your community? Ms. Lori, I'm going to start with you.
Yeah, thank you. And glad you started with me because I'm going to give you a very open, transparent answer. We are absolutely committed to addressing this, and we're beginning to see some results, but it's early in our journey for us. I'll tell you the ways what we've been trying to do. So first and foremost is that we have set a higher standard for ourselves to make sure that we are providing more nutritious food for people. And so we've said we've done okay. So I think we were at kind of 80%, but we're saying how do we get to 90, 95% of the food that we're providing to people is in fact healthier. We also have new partnerships with healthcare entities across our region. So we work with one managed care organization in particular, Health Partners Plans. So they have their members, it's an insurance company, their members are on Medicaid, which means they tend to be SNAP eligible, so eligible for food stamps. For their members that identified as food insecure, we are providing them with food. So we will provide them with either produce boxes or meals prepared by our community kitchen. And we are just this year starting to measure what the outcomes are. So we're using the USDA kind of surveys and also saying to people, are we decreasing those trade-offs? You will often hear us say that people make that tough choice between either buying their medicine or buying food, paying rent or buying food. And so we now are in the process of asking people those questions to make sure we're having a positive impact on them. With these health insurance companies and other health entities, we also anticipate being able to measure those basic things. Are they doing better with their diabetes numbers, with their and just kind of the HEDIS scores that people are looking into. And so over time, we do want to be able to measure the direct health impact and positive health outcomes on providing either fresh, healthy meals or fresh produce to people.
Awesome. That's a great story. And I'm glad that you mentioned the importance of the data. As Marissa always know, I'm always talking about data, and coming from a healthcare sector, that's my background. It's very important to have those numbers to justify why you're doing what you're doing, and also just to validate that the work that you're doing is actually being extremely effective. And then long term, it also validates for, of course, funding, if you need funding in the long term. So I think that's a awesome story, and I commend you for actually thinking outside the box. And it could be hard trying to get healthcare sectors on board and working with them, because like you said, they have HEDIS, they have metrics that they have to meet as well. So it's very interesting that you were able to make that connection and to create that program. So I appreciate you sharing that. Chad, I just wanted to open up the floor with you to see if you had any additional information regarding any health outcomes or things that you guys have done for your community.
Yeah, I was in a meeting the other day, and something kind of triggered my thought process around this. There was a person that was from Albany, Missouri, a small rural town in Northwest Missouri. And they said, we know the green peppers come to the local grocery store on Wednesdays. And so, people are trying to get to the grocery store so they can get green peppers. And so it really is a different kind of thought process when, and Feeding America has 200 food banks across the country, and we all look similar, but we also all look very different. We acknowledge and respect that. But, personally for me, I volunteer on a lot of community development type stuff, and have been in groups with other social service organizations around social determinants of health and some of those kind of things. And we actually got funding from our local hospital probably 6-7 years ago now, related to their response to their community health needs assessment. And it was just access to fresh, healthy foods. And so through that process, we purchased a refrigerated box truck, started a fresh mobile pantry program. And so, it's really helped us identify where there were gaps in actual brick and mortar food pantries, but also being able to quickly kind of get fresh produce, because the Feeding America started mixing centers to where instead of having to, get one truckload of carrots or one truckload of cucumbers, they would actually give us mixed loads of produce, which really helped better meet the needs of families that we're trying to serve and really improve access. So, a lot of times, we've got a staff of 23 total staff between drivers and warehouse and office staff and fundraisers. So that's really, sometimes we do have to kind of take a step back and just realize that the food that we're able to provide that is healthier food, it's hard to measure, is BMI going down? Are you getting access to, this benefit or that benefit? Sometimes even just providing access to that healthier food is really making a difference.
Yeah, and I agree. And I think, I don't know if Ms. Lori mentioned it, but it's because a lot of people have to decipher, do I have enough money to eat, or do I want to purchase my hypertension medication, or do I get money enough to eat, or do I pay my electric bills? So it's those real life experiences. And I think the food banks, they actually do, go into that gray area that a lot of healthcare professionals might not ask and might not know. But I think the light has come on, and I appreciate the conference that President Biden was able to administer in September, because now we're having this conversation. Now we're understanding we don't need to be in silos. We understand that the people need help. Our people need help through whatever means that we can do so. And but food banks have a huge impact on addressing that food insecurity, and also with the different health outcomes. And Elise, I just wanted just to allow you to have a comment or anything in reference to what we were talking about, how the food banks play a role in addressing food security.
Oh, I think food banks are huge. And I think too that COVID kind of maybe reduced some of the stigma that people had in going to food banks, because so many people, needed so much extra help during that terrible time. And I think that that's kind of helped people realize that it's okay. It's okay to need help from a food bank. And that's what food banks are there for. They're there to provide that healthy food, provide that access that they may not be able to get on their own. Food banks are just, I mean, they're vital. They're great. I honestly, I knew nothing about food banks until I started at Second Harvest, but I mean, they're just such a huge resource to so many people.
You're right, Elise, and you said it. You said COVID. Man, COVID changed everything for everybody in all sectors. And even I had the opportunity to volunteer at one of our local food banks here, and I was in awe. I was in awe of the lines of food, the lines of cars that were piling up because people either lost jobs, right? Because everything was shut down, they didn't have a job, and it just shifted everything. And so you're right. Food banks were there when people needed them the most, if anything. I can only imagine having to wake up in the morning, first knowing that I just lost my job. Second, knowing I have 2 kids that I have to feed. Third, I might have hypertension. Now I'm waking up. Now, where's my food going to come from? So it's very vital that, the food banks, that the great work that they did with COVID and continue to do. But another question is, the food banks are important in addressing community health disparities through the foods and the related services that they provided. How can other organizations like healthcare, educational, or economic or social sectors support food banks to assess and to respond to the population health needs? I'll start with you, Chad.
We're in an interesting time. It's just with the state of the economy, and we are a low resource food bank, so a lot of our local donations are restricted to the 19 counties we serve, and we don't have a lot of food manufacturing. We don't have any, large distribution centers, and so right now it's just there's a lack of access to any food. The USDA foods are down, and so when I look to support for other organizations, there's always that community partnership, and so working with United Way and community service organizations and homeless shelters and food kitchens, there is a ton of partnership in a lot of those things, but it's really kind of we're just trying to do the best we can to kind of identify local needs in each community that we serve, and trying to be there to support those needs. And we're doing a lot in terms of when you talk about disparities, just adequacy of service. We're evaluating the amount of food that goes out relative to need in each of the 19 counties that we serve. And we feel like that's important. A lot of times it's easier to get food out where you're headquartered and some of those kind of things. So branching out to make sure that access, we're on, we have distributions on Native American Indian reservations in Kansas, and, areas of St. Joseph where there's more Hispanic population. So really trying to reach people where we are, and just providing that access has been really helpful for us.
Awesome. Thank you. And it sounds like you said the populations that you serve in the Indian reservation and Hispanic population. Can you just talk a little bit about the differences and how you guys are adjusting to the different populations, if possible?
It's another hard topic, because you look at kind of the cultural history and the ethnicity of foods and what people prefer, and just to get anything out right now is a challenge. And so trying to identify, whether it's heart healthy food or whatever else it is, it drives up costs. It's more specific when you're looking for it. We're trying to get a lot of food out. Lori talked in 50 million pounds, we're talking 8 million pounds, but still the scope of that, and trying to bring in truckloads, it isn't always conducive to trying to kind of segment and work towards identifying better solutions for the individual.
Awesome. And I'm glad you tapped into the whole being culturally sensitive and culturally aware. Because one population might, from a cultural standpoint, prefer a certain type of food versus another type of food. And I appreciate your transparency and your honesty in regards to some of the barriers that you guys are facing, because people like me, I don't know this information, but I appreciate you sharing that information. And so, Ms. Laura, I'm just going to open up the same question for you about the different organizations that do you think that are currently at the table, or you think that should be at the table, that you're currently working with, that can help to support the population's health needs?
Yeah, I'll start with the very basic way that we distribute food, and Chad and Elise will know this well. When you see a food bank, really behind us are dozens or hundreds of partners that are kind of usually on every block. So they're pantries, they're in schools, they're in churches, as Chad mentioned, even in hospitals, they're in social services centers, et cetera. And so we really do our work through pantries. So the first way we do partners, we partner with people on the ground through what we call our agency partner network. So that's one critical way. We also, as we're looking to, we look at McLane Solutions as a partner as well. So our vendors in many ways are our partners, and we are able to say to them, here's our need, here are our limited resources, and then help us really meet those needs in ways that organizations like McLane have really stepped up. And then in terms of the healthcare system, and Chad mentioned it too, whether it's hospitals, doctors' offices that are using these kind of food as medicine or prescription programs, and then here's your prescription for produce. Those kinds of things are helpful. The managed care organizations that I mentioned a little bit earlier. You also mentioned TK, the White House Conference on Hunger, Nutrition, and Health. The national strategy that was put together. One key piece of that was really making that connection between food insecurity and health, right? And saying what can we do, what can be done at the federal level, and then across the country to provide more resources, to unlock resources that tend to go for pure traditional healthcare, to really come into systems like ours to make sure that there's more healthy food accessible. So that partnership is important. There's some things in that strategy that we're all on all sides of the aisle really pushing to make policy changes so that we can unlock that funding for us to really do this work on the ground. The other piece I'll say, and it's really related to what Chad said as well, what we put out in National Nutrition Month earlier this year is what we call our Good Food Policy. It is really what this panel is about. We recognize that we are in this moment where there was a global health pandemic, a racial awakening. We also realize that the economic crisis, which sadly we thought was kind of over in 2020, it's reared its head again with inflation. And so putting that all together, we said we want to first and foremost challenge ourselves to provide healthier food for people. More fresh produce, lean proteins, healthier dairy items. So nutrition is the first part of that policy. The second is culturally responsive. I think everywhere, the reality is America is still this melting pot. So in any slice you take of this country, you're going to see diverse people. And we want to make sure that we're providing people with the tastes and foods that are familiar to them. And there are healthy options within culturally diverse options. Then we're thinking about how we get the food. How do we equitably source it? Where possible, how do we support local farmers, minority, women-owned farmers, differently able farmers across the country? And we do see the USDA doing that, providing additional funding for us to say, we're going to purchase from New Jersey and Pennsylvania farmers in our case. And then access. I love that Chad mentioned the mobile market. We have a couple of those in our areas. Let's bring the food to where people are. One of our partners in a county outside of Pennsylvania, they do affordable housing. And so they take their mobile market with our fresh produce to the affordable housing units and bring it to people. So access is a key part of that. So through that, you can see there are lots of partnerships throughout that to ensure that we're really meeting people where that they will keep them healthy, but also that they would like.
Yes, very, very great points that you mentioned, Lori. And I like I said, it's always impressive hearing especially leadership hear how they're navigating with the community. But it's also exciting to hear the excitement and the passion that you both have in your voices, because that means that you guys are doing this with a purpose and a meaning, because you believe in what you're doing, because we know all of us on this call understands that we're supposed to help our fellow man, right? And so you guys are doing it in a way that is quite impressive, and I commend you both. I'm just over here, my heart is like, oh my God, these guys are so great. So Elise, I'm gonna ask you a question, the same question, but you're coming from a different perspective because you are that organization, right? You're that organization, your McLane Hunger Solutions, where, you know, we're partnered with food banks, we're there to help. So what role do you feel that you're playing? Like, why is it vital for you? Like when you wake up in the morning and you're just like, okay, I gotta go help somebody. Like, what role are you playing with this whole movement?
I feel like I'm so lucky because I do get to work with all of these food banks. So when I was working at the food bank, I loved it. It's just so great to be able to help people in that way. But now I get to help so many more people. So I feel so lucky in what I do. One thing that I think is so interesting in this seat, so I'm from Missouri. I live in South Carolina. My region is the Northeast region. So I have all these different regions, but what is so interesting to me is the way that each food bank focuses on, you know, their population and their communities. And it's just so different from food bank to food bank to food bank. The same in that everyone is trying to help feed everyone, but just the different ways that everyone does it is just, it's just fascinating. And it's just so interesting. And I mean, food bankers are the most caring people ever. They're in it to help people. That's the goal, is to feed people. And it's just such a great thing to be able to be a part of that and to be able to help with that.
Awesome. Awesome. Thank you, guys. So I think, Lori, you mentioned about systems and policy changes. So do you believe that there's an important need for like food system reform to improve the health for vulnerable populations? I'm just gonna, so you tapped on it a little bit. I just want to open up that question and I can just start it with you, Ms. Lori.
Yeah, absolutely. And, you know, thank you so much for the compliment that you gave us about this work. I'm sure Chad too feels really honored and privileged to get to do this, to get to serve people in this way. It is, you know, frankly, a shame that we have to do this type of work, but I think we all feel really privileged that we get to do it and get to do it with great partners. Lisa and I actually met in Philadelphia here a few months ago when Feeding America had a national conference. And so just wanted to say too, like really grateful that we have that kind of network where we're able to come together and share ideas. People tell me, if you've seen one food bank, you've seen one food bank. And so there are ways that we're all very different, but we are able to share ideas and best practices and get ideas from each other. And that's just been incredibly valuable. To give a little bit more of a sense of how food banks operate, we've talked about kind of having this network of agency partners or pantries. People know many of us are doing this root cause work, partnering with others, whether they're healthcare and other social services agencies, government agencies, et cetera. Many of us also have an advocacy arm. For every meal that a Feeding America food bank provides, 9 meals can be provided through SNAP, the Supplemental Nutrition Assistance Program, or what was known as food stamps when I was growing up. And so we absolutely are doing our part. We can talk about the millions of pounds, but we know that it's that much better for people either to have livable wage jobs so they can purchase it themselves, or even SNAP and that kind of government support to purchase it. So many of us have advocacy arms. It's why we were all, as Feeding America, represented at the conference with, I should say, 30 people with lived expertise from across the country to also get to weigh in. And so advocacy is a huge part of our work. And we're trying to impact policy changes at the state, at the federal, state, and local level to make it easier for people to access those benefits, to unlock resources for programs like the Emergency Food Assistance Program, or TFAP, which comes to the United States Department of Agriculture. And many of us have kind of government contracts for that food. We're able to get food and some admin support where they're purchasing food from entities across the country so we can get that in folks' hands. So please visit our website to learn more about our advocacy and help us encourage Congress and folks at every level to support people who are food insecure through policy changes.
Awesome. Thank you so much. Chad, just want to give you the chance to chime in on what Ms. Lori mentioned about the policies and advocacy work.
Yeah, we don't have a full-time person doing that, but it falls under my kind of day-to-day operations. But actually, I'm on Feeding America's Policy Engagement and Advocacy Committee. I'm the vice chair of the PEAK committee, and so we help even guide and direct Feeding America's policy strategy and advocacy efforts. And you know, there's a lot. There really is a lot that really impacts our work. I think we run 5 federal programs that are in different, you know, whether that's through child nutrition or through the Farm Bill or whatever it is. So there's a lot that does impact, and a lot of times it's even that our elected officials don't, I mean, not a lot of people talk about the TFAP program unless you work at a food bank. And so there isn't a whole lot of other organizations or entities out there that are going to Congress to advocate on behalf of a USDA food distribution program, because the kind of like Lori said, we really did focus on those with lived experience, really sharing their voice to the White House, and that is important because a lot of times it's even when our families are going to pick up from a local pantry, they don't know where that food's coming from or whether somebody did a food drive at a local business or whether that was provided through a USDA program or whatever it is, and even being able to respond. When China said we're not taking any milk from the United States, and but in the trade wars, a lot of those trade mitigation programs ran through the food banks. And so it tested our distribution capacity with the amount of fresh milk that we could take and some of those other things. So it's, a lot of those programs are even still based on price supports and market support. But for us, where we see it is it's really providing a much needed service to families that are utilizing those services.
Okay, awesome. That's very educational. You just schooled me on some information that I didn't even know about, Chad. So I'll be reaching out to you later to get some more education about that history. So what are you guys' thoughts of the perception of charitable food sectors evolving from hunger alleviation to additionally including health-focused initiatives? I'll just open it up, whoever wants to go.
Do you want to go first, Chad, or should?
It's it's an interesting question because you're asking about the perception of it, and a lot of times I think the perception is difficult because even working locally here in the last few days, you talk to like local elected leaders in a community and they say, well, we support another food bank. And well, that's really not the case because our food bank territories don't overlap and people confuse us often with pantries and food banks. And so it is a challenge daily to kind of communicate who we are and what we do and the role we have, in disaster relief. And, when we run into issues like the pandemic, when there's a tremendously high need, and we were using National Guard support to help with some of those distributions, like food banks across the country were. And so there's always this education that has to happen in terms of why it's important, that we're efficient with our resources, that we're accountable to whoever it is, because there's always that messaging and perception that people have for everything that you're doing.
Yeah, Miss Lori.
Yeah. So I'm going to share an old stat. I need a newer one. But according to the CDC, healthcare costs associated with food insecurity in the U.S. were $160 billion in 2014. Insecurity, not other health issues, but food insecurity, $160 billion in 2014. And so if you know that there's this connection between poor health outcomes and food insecurity, and it has this economic impact, and then we have this White House Conference for the National Strategy, I think we're really poised to help people see the connections. People are incredibly generous. People do, care about their neighbors. I think we all saw an outpouring of support, people providing more support, kids emptying their piggy banks to help us, particularly in 2020 when the pandemic hit. And so we do see that. I think it's incumbent on us to help people see, if you're not so charitable in that way, but really to help us see how collectively be that much better for us as a country if everybody was healthier, right? So we know that those costs, we're going to pay those costs in some kind of way. And so I think we really have this very raw opportunity to say, like, even if you just don't care about your neighbor, if you care, there's an ROI for the country if in fact we improve the nutrition and health, the nutrition security of folks across the country. And I think that's one way to answer it. The other one, just in a personal way, I'll say is part of why I came to do this work was because we're trying to do these two things. It really is a privilege to get to know that on any given day, we can help ensure that some family, and I should say I'm sitting in Philadelphia right now, nearly 1 in 3 children in this city, nearly 1 in 3 children in this city are food insecure. So each and every day I can make sure that through our various programs, we can help people get food and help them feed their kids. we also at the same time are toiling away to address these root causes because we realize it's a social determinant of health, because we realize it has this deeper, longer term impact on individuals, families, and communities. So I feel privileged to get to do both. And I think increasingly people are seeing the connection between the two.
Awesome.
Yeah,
Go ahead, Chad.
I would say too, I think there's a ton of opportunity and places that we can go with this. When you look, and when I see like our reach, we touch more families than any other organizations out there. And so if we could really, looking at it from our organizational perspective, we there's some instances of kind of that casework and community worker that's really kind of looking at every aspect of the household that plays into the social determinants. So if we could figure out a way to better filter our intake to know, has this person worked their whole life and retired and not going back to work because, they're on Social Security on a fixed income, that's a different way to address a family than you have a young family with children and low work skills and some of those kind of things. So it's not that we can really be everything and get into workforce development or get into healthcare, but if we can be a better connector and identify what the actual needs of the people that we're serving, I think that we could then connect them to those other resources and organization that could better serve their individual family needs.
Very, very good point, because and I'm glad that you looked at the whole person. So there's different sectors to each and every one of us, right? We all have families, we all have to eat, we all have a home, we all have a community, but all of those different sectors of all of us is a little bit different. And you said it right, Chad. It's in reference to how do we look at the whole person, and if I can't assist them with food, how can I assist them with health? How can I assist them with mental health? How can I assist them with maybe their child is going through something, or maybe they just lost a family? There's different layers to all of us, and that's vital when we look at the health of folks. Like Lori talked about, the thing about food insecurity, but we just finally connecting the two. But this is not new information. It's not new at all. It's just the light has been lit up just a little bit more now. And now it's just a focus of conversation. But a lot of people you guys have been doing this work for a long time. So, but just a few more questions to you guys. I know that food banks are more than just organizations, and we all understand it. You guys mentioned this, and they just don't provide food. I personally believe that, food banks play a bigger role in the lives of the individuals you serve and the community as a whole. So what role and impact does your specific organization play when it pertains to the community development in your area?
So I'll jump in, and I'll refer back to the fact that in this area we work with nearly 600 of these partners, and so we are really everywhere. Chad said it, like we're touching just so many people's lives, more than many other organizations, and so we're kind of everywhere in folks' lives. So we look at how we bring food to the table, whether it's kind of free groceries or meals that we're able to prepare at our community kitchen. Like kind of, we bring food to the table. And as we were just saying in the kind of last conversation, other people can bring other pieces. Like we're really clear about what our lane is. All right, so we can help people in this way. But we also believe that at those access points, somebody can get food from us, that we've provided through a pantry, but there could be a community health worker there if they're associated with a hospital. It could be somebody there to provide behavioral health supports for people, somebody providing financial literacy support, somebody signing them up for benefits. And so we can bring food to the table. We're looking for others to bring other folks to the table as well. And I think that's that I think also answers the question that you just asked, TK. For us, like we'll bring the food and kind of we are having a dramatic impact on folks' lives. We also, in many ways, I see it in our region, but I think across the country, as we're going out and talking to people with lived expertise and lived experience and finding out from them what works and what doesn't work and finding out where there are gaps, we're doing some community work as well. So what do you want to see in your neighborhood? So you want to see a pantry? Do you want to see a farmer's market? Now, some of that we're not going to do, right? Like I'm not a farmer's market entity, but we can connect you with resources that do that. We have operated a workforce development program for 22 years now. And so we have a program for people who are eligible for SNAP. It's a 16-week workforce development program in culinary arts. Throughout the program, they do they do internships with us, and externships are helping us provide meals that then are being provided to people with living in shelters, people who are experiencing homelessness, some schools and other social services agencies. And so we are providing some workforce development support, but we also are at the community level, in the neighborhood level, asking people what they want and then bring resources together to ensure that they get that. Again, us bringing the free food, but then having other people bring resources to those communities.
Awesome. Thank you for sharing. Chad?
You know, a lot of that just kind of falls on me for a small organization, just for what I am involved with and volunteer on and boards I serve on, you know, really tasked with the day to day. We've got staff that are running 100 miles an hour and doing everything they can. But, you know, like I'm the board chair of a organization that provides free mentorship to small businesses, whether it's a new startup or an existing business. That's, you know, so it's little things like that. And you know, our staff are involved too out in the community. So we try to be a community partner, whether it's a group of social organizations that get together on a regular basis to talk about local needs in the community, or you know, chamber of commerce type efforts or whatever else it is. I mean, we really are a community development organization, and we provide really that access point. There's so many touch points that we have that really connect people, and so we work with CAP agencies and you know, other organizations that are out there, and it's really a community that's there to kind of support their own and help where they can, and we're just this fraction of that, with a lot of resources to bring to the table.
You know, you mentioned CAP organizations, Chad. I think, you know, many of us are, even if I look at across the state of Pennsylvania, the Commonwealth of Pennsylvania, I think 2 of the other food banks that are partners of ours are underneath their local CAP entities. And then for Philadelphia County, we're involved with the agency. So, you know, these are entities that really, through the federal government, are really trying to address poverty at the county level. And get specific funding from the federal government to provide that. So in our city, it used to be called Mayor's Office of Community Services. In another county, it's Bucks County's Opportunity Council. But we definitely partner with those groups in many ways. I also want to highlight, back in April, I had the opportunity to attend a Feeding America conference in Louisville, Kentucky. And I know, Chad, if you were there, but I got to go on a tour of our counterpart there, Dare to Care organization. They had just opened a couple years before a community kitchen, which is a spectacular building where they have a workforce development program that is separate nonprofit operates, but underneath their unit. But they did this plan. They also operate a mobile unit with their grocery store chain there. So it's kind of low cost, and they take it to parts of the neighborhood that don't have access to food, right? Or to great food. But they also, if you look at their work, they have made a measurable positive impact on the development of that community by centering there. We just opened something not that far from Temple University in North Philadelphia, one of the most challenging zip codes in our whole region. And we're hoping that too will have a positive impact on the community. So not just having it really easy for people to access the program, but also in other ways attracting the right kind of development to the area. And so I think you also see, if you look across the country, that many of us as nonprofits, I think, are contributing to neighborhoods and community development in meaningful ways.
Awesome. Thank you for sharing that. And so I want to make sure that you guys, I'm going to make take time out for you guys to share your contact information and also your website. So, because this is really good information. So people that are watching and listening want to reach out to you guys or want to go to your website, I would like for you guys I'll give you guys a chance to do that. And also for the participants, just make sure if you have any questions, just put it in the Q&A. Elise, I haven't forgot about you. Okay. So although you're from a different perspective of a different organization, what role does McLane Hunger Solution play when it pertains to the community development from your perspective?
Our role is just really to support the food banks in whatever capacity they need. So if they're, running a specific program, I mean, we've talked about culturally diverse foods, and a lot of food banks do focus on that. And we have access to foods that are culturally diverse. So, you know, if a food bank is looking for a specific type of food, we can help with that. If they're running senior programs, we can help with heart healthy foods. So our role, as MHS, is just really to support the food bank in whatever they need help with. Getting food, you know, as everyone has mentioned, has been tough in the last couple of years, but I think it's getting a little bit better. But we have access to resources that can help in any programs that the food banks are looking to run.
Awesome. Thank you. Everybody has a role to play, right, when it comes to making sure that everybody has the opportunity to get nutritious foods. So as you all know, the White House hosted its first Hunger, Nutrition, and Health Conference in 50 years. So from this conference, Biden has laid out a plan to end hunger by 2023. All right, 2030, I'm sorry. So the administration officials announced more than $8 billion in private and public sector commitments to advance its goal of ending hunger and reducing diet-related diseases. We all know there's no silver bullet to address these complex issues. There's no overnight fix, but the Biden and Harris administration will focus on just 5 pillars. So pillar 1 focuses on improving food access and affordability. These strategies were detailed in a call to actions for all entities to do their part. So what do you believe is your organization's call to action when it pertains to the work that the Biden and Harris administration has focused on? You guys' call to action.
Yeah, I can go first. You know, I think the thing that I've really tried to share with Feeding America leadership is that it does feel like we're starting to see kind of more focus on equitable access and reaching underserved populations, and that's really I think we're starting to see it with our state agency, that it's really kind of impacting the way they're looking at USDA programming and distributions. And so, you know, for years we have looked at adequacy of service in our area, and we plotted out where our brick and mortar pantries are, and then we started the mobile pantry program where there lacked the access to brick and mortar pantries to kind of cut down the drive times and address food deserts and some of those kind of things. And so the thing I've really encouraged is that as we're, you know, like in Missouri, we're starting to feel, okay, we're trying to reach underserved populations. Let's look outside the food bank network and try to see who else can do this and move it. And it's not that we're trying to be a bad partner or territorial with some of this, but the thing that I'm trying to communicate is we've been looking at this for a long time. We're getting to places that no other people can. And right now there just isn't a lot of food available because USDA programs are down, our donations are down, purchasing's tougher. And so we're just trying to get food out as best we can. And my hope is that we really try to find ways to lean into our network and the food safety guidelines that we really work hard to adhere to, and show that we really can support the needs in our local areas and reach people really a lot better than other organizations often can, and really lean into us and see how we can help you through this partnership. And I really do commend Feeding America for bringing to the table in the conference the voices of hunger and those that are really impacted with poverty and challenges of getting access to food. And so, you know, the last White House conference was 50 years ago, and we saw a lot of things kind of stem from that with childhood programs and increased SNAP benefits and some of those kind of things. So I think this is a great opportunity and time for us to really kind of evaluate what the challenges and issues are and ways to address the need as we go forward.
Yeah, so everything Chad said, everything Chad said. And so, you know, I looked at the national strategy put out by that conference, and really felt affirmed. I feel like it really did address what we've been talking about, what we've been hearing from our neighbors in need, and a lot of really supporting a lot of the work that, frankly, food banks across the country had already started doing. And so to me, that's really affirming, and that's great. And what we need in some cases is just more help and more policy and more funds to really operationalize what's in the plan that we've been doing, and really kind of take it from what might feel like a pilot, even though there are 200 of us doing it across the country, to something that really does permeate the country in a more meaningful way. So in terms of food access, so much of what we do provide to people is free food, right? And so we do need those additional supports, investment in our infrastructure through the Farm Bill, support for TPAP, the Emergency Food Assistance Program, to ensure that we are getting that food at this moment where everybody knows everything costs more and it's harder to get. I'll give you a stat that really shocked me, and I had to tell my board this number. Last year, we bought a truckload of chicken, and it cost us $55,000. To buy that same truckload this year, it's $120,000. Price have more than doubled. Now, we know what that means for those of us that are doing okay. We really know what that means for the people who are lived expertise when they show up at those grocery stores. So we really, as Chad said, if the USDA is putting out less and things are costing more, even providing access to the free food is just so much harder for us. The other thing, if you think that's a lot, when I got here, we were budgeting to spend $2 million a year on food. Now, a lot of our food was donated, but we were spending about $2 million or less on food. My budget for this year for food is $13 million. 2 million to 13, right? So we need more money, right? We need money to meet those needs. So a big part of the access is what we're all seeing and experiencing. It's harder to get food supply, supply chain issues. All of that is having an impact on our neighbors and is having a similar impact on us. And so getting those resources. And then another piece of this that really comes through a few of the pillars is how can you get access, meaning not just providing the free food, but kind of people with more affordable access in their neighborhoods. Some of us are doing, like I mentioned for Louisville, paid food mobile pantries, actually right outside of Philly as well, Chester County. They have a mobile market where either people can use their SNAP benefits or pay $2 or $3 for some produce. So we can do those kinds of things. But a big part of this really is that everything is costing more, and kind of accessing it at every level is more challenging, and we definitely need some help with that.
Wow, thank you for that insight. Like I said, like for a layperson like me, I won't know this. And so the whole philosophy, when you know better, you do better. So I appreciate you guys' transparency, and it's good to hear the barriers that not just you, if you're facing these barriers, other food banks are facing these barriers. So I think you guys taking the time out to speak and just to make this proclamation and just to speak about the great work that you're doing, the great services that you're providing, and some of the great outcomes. But also, it's not always happy on every day. You're still having to deal with, limited access. You're thinking about limited supplies. So all of those things. And so now it allows us, people that are listening, to be more understandable and empathetic to the day-to-day operations, because at the end of the day, you're still a business, the day-to-day operations of what food banks have to deal with, and have a little bit more compassion to maybe want to volunteer or donate or to give in a different type of way. But you guys have been so awesome. I've learned so much from you all, and it has been an honor, and I appreciate you all taking the time out just to share your story, just to share your experiences, and just to educate us. That's the biggest thing, is education. We have a little bit of time. I just want to make sure I answer any questions in the Q&A. And I have a question. I'm going to ask my question. Chad, you mentioned that a lot of people think that their food pantries. So what's the difference between a food pantry and a food bank?
That's the basic question right there. So the food banks really started as a way to support the pantry network. And so, kind of like Lori said, I think when the organizations were forming in 70s, 80s, there was, I think what you were seeing is that the economy was starting to take a downturn. You had folks that were rummaging through dumpsters behind grocery stores, and people realized that, hey, there's a lot of people that need help, and there's a lot of food going to waste, and how do we put that together? So it really became kind of this rescue mission to go out and get food that was going to otherwise be discarded, and then ask the pantries to help with what we call shared maintenance. And so they would help us for storage and distribution fees to really get that donated food back out to their network. And so that was really the premise. The food banks really are kind of a distribution hub and center, and we've evolved from that. A lot of food banks have actual pantry distributions on site. Some do direct service programs. A lot really focus more on distributing to other agencies and organizations. But it's really that network of collecting food and then distributing safely to a network of other agencies.
Awesome. Thank you so much for that. Because when you said, I was like, I thought they were the same, but I don't know everything, Chad. That's why I need you guys in my life. I need all of you guys in my life right now. All right. So again, I want to say thank you guys. And I'm just going to allow each and every one of you to have a closing remark because we're just about 3 or 4 minutes out from the top of the hour. So if you could just have a closing remark, that's up to you. If we could get maybe your email address or maybe a website that if people want to be able to contact you, you can do so. So I'm gonna open it up to you, Elise.
Yes, ma'am. I just think we need to keep talking about food banks. I think that it just needs to be out there. Social media helps with that, people just need to know. Because if you don't know what a food bank is, you don't know what a food bank is. And you're very fortunate if you don't have that knowledge because you've never had the need. So the more we can talk about it, the more normal it will become. So I think that that's just kind of what we need to do. Email her at McLaneHungerSolutions.com, on McLane Global's website or McLane Health Solutions. Happy to talk to anyone.
Thanks, Elise. Miss Lori.
Great. So you can reach me at CEO@philabundance.org. And my cell, which I often give to people, it's 215-410-9876. But CEO@philabundance.org, and our website is philabundance.org. And a key for us, one of our core values is collaboration. We cannot do it alone, and so please reach out to us about ways to partner. I appreciate having this opportunity to talk about it, to really talk about the complexity of the work we do, talk about how we are trying to really support our neighbors to ensure that they have access to fresh, healthier food so they can be healthy and they can thrive. But we really welcome the opportunity to partner.
Awesome. You brave for putting your cell phone out there. Good job, Miss Lori. All right, Mr. Chad.
Yeah, no, I really just appreciate the opportunity, and you mentioned, it is easy to focus on how hard this work is right now. And it is, it's wearing on our teams. They see, are we meeting goals? Is our budgets, what's going on with our budgets? They see that stuff and it wears on our entire team. But, we're here to weather the storm. And when people need us the most, we're here to respond to that need. And a lot of times we see communities step up. It's a challenge because like you see what the stock market's doing, how that's affecting the economy. And that's when our need increases and we don't really have as many resources to tap in sometimes with local businesses and organizations. And kind of on the flip side of that, when things are going really well, it's easier for folks to give. So it's kind of contradictory, but we've been here a long time, and there's always going to be food that would otherwise be discarded and going to be people that need help and support. And so we do like to talk about trying to work ourselves out of a job and some of those kind of things. But for the foreseeable future, we're going to be here to help people as long as we can.
Awesome. Thank you, guys. All of the contact information is going to be listed in the chat. Thank you again. We are at the top of the hour, and I appreciate each and every one of you guys. We will have our next webinar on Thursday, December the 1st. So be on the lookout for any type of information on social media in reference to our next one. Thank you guys so much. I appreciate you and continue to do the great work that you do. Take care.
Thanks so
Bye.
much.
Bye, everyone.
Thank
Bye.
you.